Welcome to the Social Workers radio talk show on WCDB Albany 90.9 FM with co-hosts Dr. Eric Hardiman and Alyssa Lotmore. Here at the Social Workers, we address issues important to our communities with social work students, alumni, and community partners as our guests.
As part of the University at Albany School of Social Welfare, we hope to take social work beyond the classroom and agency settings and directly to the public, because the public is the client. Catch us on air, online, and anytime.
Welcome to WCDB Albany. My name is Eric Hardiman. I'm here with Alyssa Lotmore, and we are the Social Workers. Welcome back, Alyssa.
Hey, Eric. It's great to be here as always.
It's always great to be here. We have a great show of the Social Workers lined up for today. If you're just tuning in for the very first time, we love having new listeners. Our show is about social work in all of its various forms in the community. And, you know, the community kind of however you define that, whether it's local, state, national, international. And we've got a great conversation ahead of us today, right, Alyssa?
We do. I always enjoy having our alumni come on, and we do have an alum today. Because social work is one of those professions where it can go in many different areas. You can do macro work, micro work. You can work in hospitals, schools, corrections, whatever it is. There's so many different areas. So having our alums come on and share how that same generalist beginning branched out into so many different areas is always it's interesting to hear the story.
It is, and we know what social work is, and we have a good idea of its scope. But you know, folks listening in their cars, driving around, may not always know what the range of social work career opportunities might be. And it's always really fascinating to hear what our alum are doing. And you know, sometimes we get surprised at the type of work that folks are doing and the type of impact. And I think our guest today is a really, really great example of that. So we have with us here today, we have Taylor Perre. Taylor works at the Home Care Association of New York State as a senior associate for public health and policy, working across major program and policy areas, grant-supported initiatives, and she is a core member of the advocacy team interfacing with the New York State Legislature, state agencies, and allied associations. Taylor has a professional background in public health and social work, and an experiential concentration in aging, with positions and practice experience in quality and research, direct support services for older adults, behavioral health, hospital discharge planning, and elder abuse initiatives. She completed her Master of Public Health, Master of Social Work, and the Hartford Partnerships for Aging Education and the Internships in Aging Project, all at the University at Albany. She has 2 research papers published in the Journal of Hospice Care and Palliative Medicine about young adults' values regarding advanced directives, and she continues to research in the areas of advanced directives, long-term care, nursing homes, and greenhouse models. Wow, that's quite an introduction, Taylor. You've had a storied career already. So welcome to the Social Workers.
Thanks for having me today. I'm excited to be here.
I have to agree with Eric. That is quite the bio. And I'd like to start out just with your education at UAlbany, because I'm seeing more and more students coming in wanting this dual kind of degree between social work and public health. And I would love to hear from you what the attraction was for you to come into grad school and do 2 programs and get a sort of a different knowledge base, but at the same time, there's a lot of similarities. So I'd love to hear what attracted you to that.
Yeah, so I think for me, it started with, I'll be honest with you, social work was not on my list of career options because I didn't think that I was cut out for it. I had an internship at a hospital in upstate New York. It was a social work internship through my human development program. And that totally changed my opinion. It changed what I thought social work was. And it taught me a couple of the different options that I could go into. So when I had graduated from my undergraduate program, I had started to look into social work programs. And that's when I found out about the dual program. So I had decided that I wanted to work with children who have special needs, and social work was a great way to do so. But then I found out about the dual program and thought, well, why not try both of the public health and social work dual program to make myself a little bit more marketable, to see if there's other things out there that I would be interested in. And that's what really drew my attention, was let me see what else is out there, because I'm not entirely sure this is what I want to do. So I wanted to have a couple more options.
Yeah, but
you also, you said, I loved how you said that you were interested in working with children, and you were in the IAP program. So
Right.
I love how you kept your options open, because the IAP program, for those who don't know, focuses on aging adults. So I just like to hear how these different experiences that you've had kind of led you to a path that you never really expected.
Yeah, so I said I had always wanted to work with children with special needs, because that was what my background was in. I have a degree in child development with a concentration in child care management. So that's kind of the path that I was originally following. And then I was introduced to an aging class. It was called Managing Long-Term Care Systems. And it was all about the aging population, all about aging needs. And that kind of flipped a switch for me when we were talking about the shift in the aging population, basically. And it had opened my eyes to a whole new world and all new possibilities. And from my perspective, maybe it was because of the classes I was in, it seemed like a lot of folks want to work with children and wanted to work with young folks, whether it's at schools or wherever it may be, but there wasn't so much of a drive to working with older adults. And the class that I was in, there were only 5 people in it. So I think that says a lot to the need for the attention in this area. And that class just took it off for me.
I think we need to have like a soundbite of that and play it to students at registration time, as we're all like, I didn't get into the class. That's the only thing I want to do. And be like, see, look what happens when you take classes that might be out of what you thought you wanted to do. So I love that.
I'm so curious, Taylor, about while we're talking about your education, before we get into the work that you've been doing, post-graduation, but what was that intersection of public health and social work like, or social welfare? Because they're sort of coming from 2 different perspectives, but clearly related. And I'm just so curious from a student perspective, what that was like for you, sort of being trained in 2 different worlds, but somehow looking and finding the intersection of the 2.
Yeah, so it was a little challenging for me in the beginning, because I didn't come into the program with a social work background or a public health background, aside from the one social work internship that I did. So it was a little bit of a learning curve, and I didn't really know what social work was as opposed to public health, and I didn't know how they were interrelated. So throughout the program, I learned that they go hand in hand, and it's interesting hearing the different perspectives from social workers and from public health professionals, and hearing the different places that they come from, but we're all talking about the same thing. We're all trying to accomplish the same goals. And it's okay if we look at it a little bit differently, but it's important that we work together and have these discussions, because I was learning the same things in some of my classes, both at the School of Social Welfare and the School of Public Health, just in a little bit of a different lens. So I wasn't sure where I was going to go in this program, but I learned very quickly that it was easy to manage because it was very similar.
Great. And so then, when did you graduate?
I graduated last May, so May 2022.
Wow. Okay.
And you have that bio. I love it.
Yeah, you really have.
You've accomplished a lot.
During a pandemic, you've
was tough.
accomplished an incredible amount. So tell us about, your journey post-graduation and what you've done since then.
Yeah, so I think that my internships that I had during the program, my field placements from the School of Social Welfare, really helped me narrow down my interests. So I wanted to stick with the older adult field, and I was introduced to policy work in a few of my classes, and an opportunity presented myself to work with one of my professors on some research. So I really got ingrained into this field and all that it has to offer. And an opportunity presented itself to me to work at the Home Care Association. And I didn't know a lot about home care going into it, but I know that it's an integral part of the healthcare system. And I don't want to be doing one specific thing. I'd like to get a knowledge of as many different things as I can, because I think that it helps with the work that we do. So I was open to learning more and trying something new. So that's how I ended up here.
So for listeners, so you're working for the Home Care Association, and we've had Al Cardillo on the show a couple times, but for listeners that may not have heard those episodes, can you give us and give listeners a sense of what goes on there at the Home Care Association for New York State, and sort of what the scope of work is?
Yep. So we do a lot of different things here at the Home Care Association. We have educational events that go on, whether it's for providers or consumers. There are partnerships that we have with other healthcare associations around New York State. So we're all working towards these same goals together, whether it's hospice, home health, hospitals, nursing homes. We do a lot of work with those folks. We're focused on advocacy too, especially right now during budget season. So we do a lot of advocacy for home health care and hospice. And we have a lot of grant work that's going on. A couple of the grants that I've been involved with recently have been regarding sepsis work and hospital home care collaboration. So we do a lot of stuff, and our members consist of MLTCs, fiscal intermediaries, certified home health agencies, and licensed home care service agencies.
Okay. So we've heard about the sepsis program, but I'm so curious about the hospital collaboration piece, the home care hospital collaboration project. And I've probably gotten some of the terminology wrong there, but can you talk about that a little bit?
Yeah, so one of the major parts of this, I think, would be education on what is home care. So I think there's a misconception of home care is just for older adults, or it's just for folks who have disabilities, and it's just basic, housekeeping needs and home stuff. But while it is those things, it's also so much more. It's really a hospital level of complex care that can be delivered at home. So from getting folks from in the hospital to at home, getting nursing home level care in the home is pretty complicated. So we had received this grant from the Mother Cabrini Health Foundation to work on hospital home care collaboration specifically. And through this, there are a few different initiatives, a few different directions that we're going in. And one of them is a research-based initiative. So we have released a couple of reports. I can provide the link to those later, but they are about collaboration, basically. So one of them is mental health and home care collaboration. Okay. One of them is aging needs collaboration. We did a collaboration report on the vaccine hubs that were around New York State during the beginning of the COVID-19 pandemic. And we have one more that's on basic, just how to collaborate and why it's important in this sector. So part of it is education on what home care does. So home care is, like I said, complex care. It's wound care, it's ADL help, so bathing, toileting, dressing. It's helping folks get out of bed in the morning and transferring to their chair if they need to. It's helping folks go to the bathroom. It's providing post-op care. So if somebody gets a hip replacement and gets sent home, they can do their rehab at home. So it's about how to connect the dots and not just leave the person hanging once they leave their facility that they're at.
And you've been on a few reports as the author of a few reports for this that have been sent to the governor and state agencies to talk about these important issues, because I think, as you said, it's budget season. And I believe this is a top priority for, the governor. This is the aging, mental health, and basic general health for moving forward.
Right. Yes, that was a big part of the outreach as well, was now that we've done the research, we've created these reports, how do we get this to the people who need to read them and who need to participate and take action from them? So it's been a lot of outreach, meetings with legislators, meetings with our members and our board members to try to spread the word on this is why home care and hospice funding is so important, and this is why collaboration is so important to just meet these goals of individual healthcare need goals, and system level goals as well.
Yeah, I mean, one of the critiques about research in general from, usually from folks that are not researchers from the outside is that research is done and then not used, that it's not applied. And sort of what I'm hearing from you is, just an incredible focus on application and taking reports and work that's being generated from your organization and meeting with legislators and meeting with key decision makers and looking at how policies are implemented around the state. What types of things, this is a big question, I apologize, but what types of things have you learned about that process of kind of applying things that you found in your reports and taking it to legislators? What kinds of things have you learned about how that process works?
I've learned a lot. This whole process is completely new to me, especially on this intimate level. I've learned that it's easy and hard because we're all experts in something, but we're not experts in everything. And you have to learn how to communicate to the right people, the right information that they will comprehend and in the right way. And if you're not sure how to do that yourself, you have to learn how to do that before expanding it and bringing in other folks too. So it's a little bit of, from the outside looking in, it's an intimidating process, but it really is having conversations with the people who are able to make the decisions and informing them of why they should make a certain decision or why they should sign on to a supportive letter and providing memos for them on some education. Because like I said, they're not experts in home care, maybe. Maybe they're familiar with the healthcare system, but they don't know how home care fits into the healthcare system. So I've learned that it takes a little bit of research and preparation and practice. You have to practice your communication skills so you can give them a quick elevator pitch, because sometimes they're busy and they have to go somewhere in the next 5 minutes and you have to be quick with your delivery. So it's good to know that there are people out there who do care and are helping and are working hard to support the healthcare industry and make these important decisions. But it is a process and it's a learning process.
No, I loved how you mentioned that, like the elevator pitches, and there's just so much of stuff we do for the social workers and some of the media courses that we attach to the students were interested in that. When we talked about the radio show and the podcast, students were interested in learning more. So we had developed a class for media savvy social work. And so much of that was about how do you get your information out there in a clear, concise, and engaging way to the audience that you need to, especially when there's other people competing for that same attention. How do you have people want to care about a topic that you care about when they might not see the connection of how it's even relevant? How do you expand that? And it's so much of what you're saying. It's like, yes, these are the things that we're talking about in social work, because it does apply as you're going out there and advocating and trying to make that change on the macro level to help individuals. That's where you need that. So it's exciting to hear that you're doing that in the macro and that macro level. Because so many students sometimes don't see the connection of why do I need to learn how to communicate to a politician? That's not social work. It is social work. And that's a great example of why.
Right. And I like what you said about making it relevant, because I think that's exactly what you need to do when speaking to folks who might not be as knowledgeable about the topic. You have to make it relevant to them, whether it's a personal story or the constituents in their area or statistics or a specific disability or a specific physical illness. Somebody can always relate to something, is what I've learned. And you just have to know how to reach people in a way that something will click for them and they'll understand, and then they'll be at the table with you.
So if you've just tuned in, you're listening to WCDB Albany. My name is Eric, and I'm here with Alyssa Lotmore. We are the Social Workers radio show and podcast, associated podcast. And we've been talking with, and we'll continue to talk for a few more minutes with Taylor Perre. Taylor is Senior Associate of Public Health and Policy at the Home Care Association of New York State, and also an alum, if you just tuned in, of the School of Social Welfare and the School of Public Health here at the University at Albany.
So Taylor, I guess as things have changed so much, I mean, you came in as what you say, child development major into grad school, trying out public health and social welfare. You weren't really sure. You wanted to work with kids. And then you go into the internships and aging project after taking a class that you were really interested in learning about gerontology. And now you're doing policy work and, writing reports that are getting, reviewed or sent to the governor for, budget, trying to get more funding. Things have not always gone as you planned, but it's been working out. Where do you hope to go next? And, or where might you go next, even though it might shift completely from what you say?
That's a good question. And I'm not sure I have an answer because I think I'm enjoying things as they happen and as they go. I would like to stay in this field, of course. I know that I've always wanted to be in the helping field, in the healthcare field to some capacity. And I think that my educational path that I chose was, getting the childcare knowledge and the children knowledge, and then the aging stuff and the life course span. And I've accidentally purposefully kind of rounded out my knowledge there and left it open because I don't see myself only doing one thing. So I know that I'll still stay in the healthcare sector to some capacity. I like working in home care. I didn't know a lot about home care before I started here, which is promising in the sense of you can always keep learning. You can always learn something new. And I'm not sure where I will end up, but I'm liking this path that I'm on right now. And I know that it will be doing something similar to what I'm doing right now.
It's a great answer, Taylor. And, it sort of occurred to me listening to you a little bit earlier. I think you used the word intersectionality or intersection. And, it seems like a lot of the work that you've been doing and are continuing to do looks at like various intersections, the intersection of public policy and public health, social welfare and public policy, the intersection of physical health and mental health and aging and the lifespan. And so it's really fascinating to me that what you're doing and able to do through the Home Care Association is to really kind of hone in on these various intersections of lots of different domains out there. And that to me sounds really exciting. And I wonder if you think of it that way too, or is that just my kind of outside perspective?
No, I think you're spot on, and it is exciting. And it's nice that there are a ton of different avenues that you could take too, and different specialty areas that you can lead yourself to. There's always a million different educational events that are going on, and they all affect everybody. So it's nice that there's different paths that social workers can take in their careers.
I'd also like to make a request of you, which is that it would be really great to have you come back and talk to our MSW students and talk to them about your career. Even though it hasn't been that long, you've accomplished so much. But more importantly, like I said, you've really kind of shown a unique and creative pathway through the profession that I think could really inspire students who are kind of trying to figure out what this profession's all about as they're learning it.
I'd love to. I think it's important to know that social work isn't just one thing. It's not just clinical work. And when I went into the program at first, I didn't know that there were macro options and what those options were. And I will plug in that I'll be there on March 28th to talk to the social gerontology class.
Oh, great. So you're already connected. Okay, perfect.
I was about to say, I'm like, we're going to call you all the time now.
But I would love to come speak to another class too.
Well, I want to thank you so much for being a guest today and just talking about your pathway, because we get a lot of people come on talking about clinical or just social work in general, but with the school public health connection and just the way that you found your way and navigate it to this unexpected but very rewarding and awesome path. I think it was I'm really glad you came on and shared your story and your journey with us. And even it's just beginning. So like Eric said, I'm really excited to have, I would love to have you come back on the show again. Oh, you make so much progress in such a short time. I mean, you only graduated in 2022. We could have you on every year, and I'm sure we'd have some new and exciting achievements and accomplishments for to talk about. But we'd love to have you come back on and just share where you're headed.
And the fact that you've engaged in scholarship and published 2 articles too, and that getting your ideas and research out there into the larger sort of academic world is also really unique. And so at some point we'll try to rope you back into the doctoral program.
That's what I've heard. I've been told I should pursue that, but it's still up in the air as of now.
Okay. So
we just need to get her in a really cool doctoral class, like to audit it, and then maybe we'll be the key.
That's what happened with aging. Yep.
There you go. So you've been listening to the Social Workers on WCDB Albany, and we've been talking with Taylor Perre, who is at the Home Care Association of New York State as a Senior Associate for Public Health and Policy. And just, if you've just listened to our conversation, I'm sure you'll realize just what incredible work Taylor's been doing as a graduate and alum of the University at Albany, making a difference in the community locally, making a difference in the state, and working with a really innovative and significant organization, the Home Care Association. We've had Executive Director Al Cardillo on the show at least a couple times, I believe, Alyssa, and he's always a wonderful guest and always welcome back. And it's great to have connected with you as well, Taylor, and thanks so much for being our guest.
Thanks so much for having me today. It was really nice to talk to you both.
So where can listeners find out, more? Are there, do you want to point listeners to the Home Care Association? And then Alyssa, do you want to talk a little bit about, where folks can find old episodes if they need to?
So if you're interested in learning more about the Home Care Association, you could find us online at hcanys.org. We are in the middle of a website rebrand, so everything will be changing, but there's a lot of great information out there.
Great, thank you.
And for the social workers, you can always find old episodes. I mean, we've been doing this for about over 10 years now.
Over 10 years, yeah.
So we have a lot of episodes. If you go on we have a YouTube channel, Social Workers FM. We also are on Apple Podcasts and a lot of the podcast platforms. And you can find us on our website, which is the Social Workers Radio Talk Show, and .simplecast.com. Long website, but you can find us if you just search the Social Workers Radio Talk Show.
Search engines work. If you say the Social Workers Radio, you'll find us. So thanks for listening, everybody. This has been the Social Workers on WCDB Albany.